Thank you, Professor Gupta, for joining us and to answer some of our many patient questions. Just as by introduction, Professor Diraj Gupta from Liverpool Heart and Chest Hospital, who is also a member of the AF Association Medical Advisory Committee. Thank you. Will most people with AF eventually need a pacemaker, or who should have a pacemaker if they're diagnosed with AF?
First of all, to answer your question, whether most patients with atrial fibrillation will need pacemakers, I would say no. In fact, most patients with atrial fibrillation will never need a pacemaker. So the only reason for you to need a pacemaker is if your heart rate is too slow, either naturally, and that can happen as you get older. Your atrial fibrillation, rather than causing your heart rate to go too fast, can be associated with a heart rate of being too slow. As I said, usually tends to happen in the older people. In that case, you might need a pacemaker. Or sometimes you need a pacemaker because the medications that are needed to control your atrial fibrillation tend to slow your heart rate down. For example, beta blockers. As I said, beta blockers are very effective for atrial fibrillation, but they can cause a slow in heart rate. And in those cases, it's a perfectly reasonable treatment option to give you a pacemaker that'll prevent your heart rate from going too slow on beta blockers, and then give you the beta blockers to treat and prevent your atrial fibrillation.
And one patient's been offered a pace and an ablate, but they're scared of being reliant on a pacemaker. And what if the battery runs out or fails? What will happen?
Well, modern pacemakers are extremely reliable. They are very, very reliable indeed. And I've never heard of a pacemaker that just fails. So usually these pacemakers have a battery life of about 10 years. We tend to follow our patients routinely at about once every 12 months. And then as the battery starts draining every 6 months, a lot of the follow-up now is done remotely anyway, without the patient having to come to hospital. So that's a fear which is perhaps unfounded. So ablate and pace treatment is a very good treatment for people in whom catheter ablation is either not an option or it has failed. So it's a palliative treatment. So patients are still left with atrial fibrillation, but it doesn't allow your atrial fibrillation to cause increase in heart rates. And it often is a very good symptomatic relief, such as palpitations are often relieved with this treatment. You still have to take oral anticoagulation though, and that's something which I always tell patients, especially patients who have had ablate and pace treatment, that the atrial fibrillation is still there. They still need to take oral anticoagulation. The only thing is they won't be quite so aware of atrial fibrillation once they've had this treatment.
I think that's a really important message. Just because you've had a pace and ablate, an ablation, doesn't mean to say that you should stop your anticoagulation. I think a lot of people think after that, it's not important. So I think that's a very key message.